Healthy Womb, Healthier Women was written by the famous Wang family gynecologist who pioneered traditional medication that has been passed down for 800 years. Listed as a national intangible cultural heritage, it comprehensively examined the issues of women's health and promoted ways of caring for menstruation, vaginal discharge, childbirth, and menopause. Womb and menstruation. The womb can be a source of blessing or misery to a woman. Good blood circulation in the womb is a sign of good health. A woman typically undergoes about 500 menstrual cycles and ovulation throughout her lifetime, and regular consumption of cold, raw, pungent or spicy foods or an irregular lifestyle may disrupt the body's physiological system and result in irregular menstruation. The primary function of menstruation is to nourish and cleanse the uterus by removing anything that has accumulated in the past 28 days over the period of a week. This process supplies fresh blood to the uterus, renews the inner wall of the uterus, and prepares it for the next ovulation. That's why the importance of a menstrual cycle should not be underestimated. Healthy women generally have regular menstrual cycles with normal blood flow and color and no menstrual discomfort. Menstrual pain is a sign of poor blood circulation and is the womb's distress signal. As reported by the press, irregular menstruation may be an early sign of ovarian disease. According to Healthier Womb, Healthier Women, a woman who often has irregular periods, blood clots in the period, or bleeding between periods has a high risk of gynecological diseases. These include endometriosis, uterine cancer, abnormal uterine bleeding, infertility, and so on. Vaginal discharge. Unlike menstruation, vaginal discharge occurs throughout a woman's lifetime. This discharge has lubrication and cleansing functions and helps to regulate the body and detoxify it naturally. If menstruation can be described as a total house cleaning, discharge can be likened to a regular cleansing. Good health is characterized by normal discharge. Small amounts of discharge indicate vaginal dryness. Yellowish discharge is a signal that the body is too hot and damp, while smelly discharge is the body's natural mechanism to expel dampness and detoxify itself. Childbirth. Apart from childbirth, the confinement period is also the best time for women to improve their health. Every woman undergoes dramatic changes during pregnancy and after delivery. At the final stages of pregnancy, the womb weighs 1 kilogram, which is 17 times its weight before pregnancy. Natural childbirth opens up the cervix by about 7 times. Therefore, great care is required to achieve 100% recovery and avoid the problem of uterine prolapse. After giving birth, women usually look pale and listless. The body is also weak and may be unable to cleanse the uterus by itself. That is why intensive care is recommended to help women recover within 30 days after the delivery in a holistic manner by 1. Getting rid of lochia. 2. Helping the uterus contract. 3. Assisting healing of wounds. 4. Restoring vitality and energy levels. Menopause. Typically, menopause occurs around age 50, but some women only experience it at age 60, as they have taken good care of their womb since they were young. Menopause refers to the condition whereby ovarian functions deteriorate and hormone secretions decrease just before menstruation permanently ends. It affects cell metabolism and results in a thinner vaginal wall. That is why it is critical to delay the onset of menopause and alleviate its symptoms. What is the best way to take good care of our uterus and ovaries? We recommend a women's health formulation that has been popularly used for 15 years. This formulation taps on the power of 6 traditional Chinese herbs. 1. Salvia helps to eliminate blood clots. 2. Herba leonori assists in uterine contraction. 3. Angelica sinensis enriches the blood. 4. Astragalus helps to restore qi and vitality. 5. Petraeonia detoxifies and reduces heatiness, helps to improve yellowish discharge. 6. Codonopsis helps to increase qi in the spleen and stomach. This formulation is developed based on the accumulation of uterine care knowledge that has been preserved in China for over 800 years and is clinically validated. Ordinary females. 1. Helps to improve blood circulation in the womb and increases vitality by up to 94.59%. 2. Helps to improve fatigue, anemia, and negative female physiological symptoms. 3. Helps to nourish ovaries and assist in recovery of the womb. Postpartum females. 1. Helps to restore overall uterine function by up to 92.48%. 2. Helps to increase red blood cells and hemoglobin after delivery. Menstruation, vaginal discharge, and childbirth are integral parts of a woman's life. Only when you are healthy and energetic, you can be free of diseases and live a happier life.